Well, actually, the mental health services have got a really long history of being one of the most underfunded parts of the NHS, and being quite stigmatised, and having real difficulties in terms of staffing and resources. This has been highlighted really in the pandemic, where there's been a spotlight on mental health, particularly children and young people's mental health, and realising just how little resources there are compared with the amount of demand out there. And that's partly been accentuated by the fact that we are getting much better at picking up on a lot of mental health difficulties and conditions. For example, autism, we're picking up a lot more autism nowadays than 10-15 years ago, and that's also because schools and communities are much better at picking things up. But it does mean that there is a real struggle in terms of services to meet need. The Royal College of Psychiatrists has worked really hard in the last few years to try and develop parity of esteem with physical and mental health, and that has gone a long way into addressing some of the stigmas and difficulties in terms of people with mental health services face in mental health services face. So in terms of what impacts on mental health, so there's a whole host of factors, and I cover this issue in quite a lot of detail in part 1 of the book, and that covers a huge range of different factors which can potentially impact children's mental health and well-being, from biological factors like what genes you inherit and your developing brain and how that changes as you grow up, to lots of different lifestyle and environmental factors like different stresses children, young people face from school, and nowadays technology is a massive one in terms of the impact on mental health, because it seems to be with us 24/7. A lot of children, young people have their own phones and social media, so being aware of all these things is really important. I also discuss about the impact of other factors like sleep, nutrition and relationships on mental health, and a wide range of stressors and things like trauma and abuse that children, young people can face. I also discuss the particular difficulties of vulnerable groups, so young carers, people with physical health problems, the LGBTQ population, and discuss how these young people may struggle more, and things that people can do to help support them with their mental health.